was able to breastfeed him until he weaned, and then the next baby and the next baby and the next and the next. And that opened up like a whole world of discovery. Homebirth really opened up our pathway to discovery.
Speaking to you dads, to the husbands, even if you're not really on board with a home birth, or you're nervous because you've never had anyone around you that had it, trust the mom and the mom instincts. In this video, we want to talk a little bit about what inspired us to have home births.
Yeah.
And not just in different countries, but home births and what we have learned throughout having 6 of the home births. So, home birth. I mean, honestly, for me as a guy, I never even thought about birth until, probably not even when we found out until we're pregnant. I mean, even then, that's not something that was on my radar. I mean, that was more something when we found out we're pregnant, it's just, okay, we're pregnant. And then you deal with...
Then it all came piling in of what do we do? What do we want?
Yeah. And I guess the urgency is the morning sickness. And so I didn't think that far ahead. I was just, we're pregnant. The morning sickness, for some reason with the girls, it was always worse. And our first one was a girl. And but then you started, actually through a friend, mentioned home birth to us. We never even thought about it. And I guess I should say the only birth story or thing I knew about was from my sister. I have an older sister. She has 2 children. And I just knew that, and that is in Germany. I'm German. My sister birthed her children in Germany in a hospital. But it's so different there because you go to the hospital, you have the baby, and a few hours later you go home. You don't spend the night unless there's been some complications or so.
About the differences,
yes,
in the different countries that we've had births in, because they are significantly different.
Yes,
the point of view and just the way they care for the mother, and we've learned so much from having babies in different countries. So we will cover all of that maybe in another video.
Yes. Yeah.
So about the differences. The very first thing that inspired us was my friend who mentioned a book for me to read, and I went home and got that book and started reading. I think it was a Birthing from Within book or something, and it kind of just started sparking my curiosity of actually having an amazing home birth rather than this hospital birth that society paints for you and that you see on TV or whatever, this traumatic experience. And so then I started realizing that there was a better way. And I started trickling in little bits of information to him. And then someone else recommended, or maybe it was the same friend, because I didn't have many people in my circle. I had a lot of friends who were having babies, and none of them were choosing to have a home birth or a natural birth. And everyone was like, give me that epidural as quick as possible, and I was the one that was doing it different. And I didn't have anybody to bounce ideas off of or anything. So this one friend was like, you guys should also, because we kept talking about it. And she was like, you should watch the documentary, The Business of Being Born. And so we watched that together, and we knew, we already knew going into that documentary that we were going to do things differently, but we didn't know how. And that documentary just closed the door on hospital birth for us. We're like, no way do I want to even put myself in that situation. Even if for people who have good hospital experiences, I still don't want to have a needle. I don't want bright lights. I don't want men coming in and seeing me in that vulnerable state. I want to be and so anyway, I get into this a lot because I'm so passionate about how we have our babies and being able to just be present and to have our baby in a clean home and not surrounded by germs. I mean, who wants to have their baby with those things? So
one time we were at a coffee shop, and the owner of the coffee shop was all about home birth. And he was like, "Oh yeah, why would you want a healthy baby in a house full of sick people or something?"
Mm-hmm.
That was funny. But for me, if I can throw that in, home birth was, it was never on my radar, obviously. And then we watched the Business of Being Born, and I guess the first thing that I learned about having a baby in the United States, because I was living in the United States, and I was like, people pay like $10,000 for like 2 days at the hospital. And I was like, that is insane. Like, and so, of course, the first thing, like home birth, yeah, I mean, you pay for the midwife, but otherwise, you don't, I mean, whatever
And
you buy,
insurance
other
doesn't
stuff.
cover midwives in most places. So
Yeah.
that is something that some people will say, but
Yeah, but the cost
in
is
general, the cost is
so
so much
much
less.
less. Yeah. Well, also, we lived in Alabama at the time, and at that, it's changed now. The law has changed, but midwifery was illegal. And
Yeah.
so that was a huge thing for me. Is like, I mean, if we can find a midwife, like, we're not going to have a
Finding
baby
a
at home.
midwife was such a big deal.
And then we found just unbelievable, like that lady, her story, like, we were like baby number 1,000 or something that she had delivered. She was an older lady. And when she was 12 years old, I remember was her story. She was a child to her parents were missionaries. She was in Indonesia, and she was at this lady's house, and this lady told her to fill up a big tub of hot water. And then that lady just had the baby there. And that's what sparked our midwife, to
Yeah.
become a midwife.
And
And
in the course, in the Healthy Home Birth course, I walk you through how to find a midwife, even if you're in a tough situation like that where it's hard to find, and give my experience with calling her up for the first time. Because she just was so excited when I was like, "Is this the midwife?" And she was like, she died laughing. She's a sweet lady. um, and just so happy to be found and be able to serve with her passion. So that's one really cool thing about home birth, is that you're surrounded by women who are passionate about natural childbirth and passionate about the well-being of the mother, where when you're in the medical system, even at your prenatal appointments with your OBGYN, you're just one more patient. They just push on through, do the things that they're supposed to do. But with a midwife, it is like your favorite day of the week, or the month, whenever, however often she's coming to your house, but it'll be your favorite because she cares for you. And as a pregnant mom, you want to be cared for and nurtured throughout your whole pregnancy, and to have the midwife come and ask you if you're okay and look at you and maybe she'll bring you a basket of eggs like our midwife did so often, or something, just some comfort, something. And she just comes in with her warm smile and hugs you, and it's just a wonderful experience compared. And I do have experience with going into prenatal appointments in the
mhm.
medical system, especially with our second baby. I tried to use a midwife that was, for a while, I tried to use a midwife who was also an OBGYN, and it was just so medical. I had dreaded those appointments because I knew I wanted to refuse a lot of the things that they want to do at your prenatal appointments, but they really make you feel like you can't refuse it. And if you do, you're a bad person and you're not taking care of your baby and all these things. If you want to just let your baby be and let your body be. So anyway, that's a whole nother topic, but
Well,
that
but
is
it's,
what inspired us to choose a
yes.
home birth, was our eyes being open to the potential dangers that were there if you have a hospital birth, like all the interventions, like one thing after the next. I think that is where our inspiration started.
Well, so if I can throw something in, we went to one of the OBGYN appointments, and I don't know if we mentioned a home birth or afterwards, something, if we needed a paper or something. We got the worst attitude from this one lady who was a doctor, which was, a lot of people in the region, in the town we lived at, everybody was like so
That
excited
was
about
when
her.
it was illegal.
Yes,
And she
but
kind of got the hunch that I was going
oh, she was
natural. She kind
mad.
of, I said a little more, and she was very hateful and did not see me anymore. So that was like a slap in the face, but also it was okay. Like, that was the beginning of my tough skin. And I've had 10 years, because then it came to having the baby and having to make a lot of decisions which I also walk through. I wish I had someone to walk me through that in the beginning. But again, we were doing this kind of on our own because our friends were doing all the medical things that are typical, and we were doing it so differently. We were like, we felt like we couldn't really talk about what we were doing. So we had to develop tough skin. But looking at it from this side, I wish I had someone like this to say, hey, it's okay. You can say no to that. You can make your own choices. It's your body, it's your baby,
And also, we don't want to hate on the medical stuff. Like with our fifth one, we had actually, there was some issues, stuff anyway. Like we had some visits. We still ended up having the birth
We
that
will
we
share
wanted.
his birth story. I don't want him to give too much
No,
away.
I
That's
know.
why I'm like,
And I'm saying, like, if there is
we have had to
something,
use the medical system. Yeah.
if there's something that
And
comes
they're,
up, like it's okay. But in general, we are very strong. And obviously, you've already heard that. You got the hunch that we
we
are.
definitely believe there are times where the medical field is needed. Like you need medical attention.
Yes.
Absolutely.
But in
But
the
birth
last,
is,
whatever happened in the last, the change in the medical system in the last 100 years versus, the thousands of years before that, like birth was a slow, intimate, calm process
not a
or
medical
event, and
situation.
not this, like in the movie, busting through the doors and the woman screaming on the stretcher
And
and stuff. And that's what I thought of birth. And then when we had our first home birth, and obviously I've never attended a birth before, and it was like it took a long time, but it was
but
very
so
calm and intimate, and and of course it was hard, the first birth and stuff, but
so many of the things that you hear about that go wrong during a childbirth are because of an intervention that has been made at the hospital. And it could even the smallest thing of like the woman going into that room with bright lights and people looking at her, and she closes up and gets fear, and she just like tenses her body and think her body does not work, the hormones can't flow, she starts getting scared, she can't do what she needs to do. So even that's not even like a medical intervention, that's just making a woman feel uncomfortable in the middle of something that's supposed to be so private. And so that's even, but think about then her body closes up, so the labor slows down, so then they give Pitocin to speed up the labor and to start the contraction. Oh, her labor stalled. We need to. It stalled because she feels very insecure right now because all these people are doing stuff to her. Maybe she had to get a needle and her blood pressure checked, and they hooked up her belly to all of these different things. And she doesn't feel comfortable to labor, so her body closed up. And then they start with an intervention. And then the baby's heart rate goes down. And one thing after the next leads to these traumatic experiences that you hear about. So when you don't have any of that, there's such a high chance that you have an amazing birth. So that's my passion and all of it.
I just seen this calm process, like being at home. And I remember um, with our second one, he was born New Year's Eve, and it was obviously a slow time of the year anyway. Like most people, or a lot of people don't work, and it was just we were just at home. And I guess one lesson I took away there, we actually had a pool with him, or was it with the first one? I remember, but I did learn that the water heater did not have the capacity to fill the whole birth pool up
That
with
was
hot
the
water.
first baby.
And like we tried so many things, and of course, and I guess that's one takeaway. Same with, of course, first time parents, when after the baby's there, they're equipped with a diaper bag and all this stuff. But birth itself, it can be so simple. And
Yeah.
if you have access to a birthing pool and hot water, and it's great, but it just didn't work for us because the timing wasn't right. By the time actually delivery happened, the water was cold, and like it was just like
The first baby was just something else. And I so wish that I had the insight that I have now going into, if I could redo that first birth with this knowledge, it would be amazing. But I can't. But I love the journey that I've been on because I've been able to help so many other moms and give them some tips and things of like, hey, do this, don't do this. Like when your labor starts, you need to rest. And here, instead of just like get excited because it might be a long time, like all of these things I wish I had insight into for my first two births. But it's exciting because with each birth, I got better and better at birthing and knowing what to do. And so I'm excited to be able to pass that knowledge on. My hindsight 2020. That's what I was saying to him earlier. Hindsight's always 2020. I don't really know how to say this. Hindsight's always 2020, and I guess I feel like I'm giving a gift to other moms who are going into their first and second births of my hindsight that I can say, okay, here, you can take my hindsight and use it to have clear vision going forward and know what you need to do and know what you don't need to do, and how can you keep labor going, and how can you speed it up, and what position can you birth your baby in to make the baby move down faster, and all of these like things that I wish I had known, I can pass that on. So that's what I'm so excited for with the Healthy Home
And
Birth course.
from my to the dad, I mean to both of the parents, the parents to be, or even if you have already a few kids, I think like this whole there's I mean it's a money making industry, the whole thing across the board, and it's like don't overcomplicate it. It's the birth is going to happen, the baby's going to come out, and of course you want to be prepared, but you also don't have to spend thousands
When you're letting
on
the woman's body
stuff,
work,
things to,
it just works.
yeah, like
So
it's not like
eye-opening
you
and
have to
beautiful.
buy all the things. And I mean, of course you want to be prepared, especially if it's a first baby, you want to be overly prepared and stuff,
That's one
but
thing I wish I
it's
prepared with our first baby. I had everything you could think of, like lined up, first baby. But I wish so much I would have thought more about pregnancy and postpartum and birth, and not so much on like what do we have and what do we not have, and all of the stuff. The stuff is insane. There's stuff for everything. It's so crazy. I have list in our Healthy Home Birth course of what is actually needed. And it is not all the frou-frou stuff that you would think of. Like, of course, that's fine if that's you and you want to do that. I did it too. But after my third, fourth, and fifth and sixth baby, I had the necessities, and it was so much more easy to keep up with. It was clean and not so cluttered, like with all of these random baby things that are unnecessary. And I was focused on mental preparation to birth our baby and mental preparation to go through postpartum versus what you were talking about with all this stuff.
like having being overly prepared with stuff. So having births in different countries, if you live in the same house for all your births, you can accumulate the stuff, and then you have it for the next birth, and you may buy
Yep.
something else. But in between that, after the first two, we moved to Germany, and all we brought was like a crate, basically a few suitcases. Like we didn't get a container and brought all the stuff.
Mm-hmm.
And then when we moved to Mexico, I mean, we only had suitcases, 4 kids.
Yep.
At that point, we were already pregnant. We knew we were having a baby in Mexico. It wasn't planned, by the way. We thought it would be in Italy, but that's a different story.
Coming
um,
soon. We will talk
yes,
about our travels with all of our kids and our births in all these different countries. We've had an adventure.
but what I'm saying, we were simply weren't in the able to just have a lot of stuff, or then have the money to buy all the stuff wherever we moved to,
Well, and we
and it's
couldn't lug all
fine,
of
and
that
it's
stuff around,
yeah,
and with the lifestyle that we had chosen. And it was so great to experience. It was really easier because you
yeah.
just have less stuff. And
Yeah, and less to worry about. Like if you don't have a pool to set up, like you don't have to worry about that. Now, is the water going to be enough or whatever? And like all the things. And I'm not talking against the pool, like absolutely not. But it's simply the fact what you don't have, you can't focus on, especially obviously in during labor. And so less really was more. And thankfully, most of our kids were born either in the like early in the morning, or then
or in the
maybe
night.
around night, or maybe breakfast time. But
Well, actually,
the other
our
ones were
sixth baby was born in the afternoon. I
yeah.
labored all morning. I started labor at like 9 or 10, and she was born at like 1 o'clock. But we'll
But the
share
other
our birth
kids, the other
stories.
kids were usually either asleep or then also old enough to kind of
We
be on
keep
their
getting
own.
ahead of
And
ourselves with our stories. We're so excited to share it all with you guys.
but
Um,
back to less is more for us, at least. It was very, very good. We had few things, and it was just more calm. And yeah, so that's one thing that I would pass on. Again, everybody's different, but just having less stuff and being more focused on each other, me being
mhm.
focused. Like I didn't have to worry about setting something up, but I could be there for her, especially then with baby 5 and 6. There were free births. There was no midwife there. And I could just be there for Haley and talk to her, encourage her, and remind her of the things that we had learned. And so that was very, very, and that made a big difference. I remember. I
Yeah,
mean, there was one point where the labor pain, the contractions got really, really intense, and you started to kind of freak out a little bit. And but we had talked about that, just relaxing in the pain, let the pain, because when you tense up, the pain gets worse. But when you relax and then just focus back on taking your breaths, breathing in and out slowly, relax, and like just I could
yeah.
be there. I wasn't distracted because there was nothing there for me to do besides being there for Haley,
I
and that
think
was
that's one thing that worked really well for us was communicating really well. Like I included him on what I was learning at, even though it was my first baby. Of course, through the fourth, fifth, sixth babies, I was very like, here's what I want from you, all of these things. But even with the first one, I was like, here's what I'm reading, and I think that this is going to work best, really communicating with him so that he understood where I was. And I think that would be one of our takeaways. That would be really um, helpful, that I was just always communicating with him, and he has been able to show up so well. And I love that in our healthy home birth course, because he talks to the dads and gives them like practical advice of how to be there. I can't imagine if he had that with our first baby. Like he didn't even think of a lot of things that he knows now, and with that, to have that is just like super beneficial for a new dad, or maybe a dad of, maybe it's the first home birth, maybe you already have children and it's your first home birth, and you need your husband to show up, you need him to be there for you. Like what if the midwife gets stuck in traffic, or you just want him to know what to do and
which
how to
has happened.
support you. And yes, he has been my only person there for me for two of our births. So it can happen. And it's just so important that the husband can be on the same page. And I think often it's hard to know how to include your husband. Like having this resource in the healthy home birth course for the dad is just really, I wasn't even going to talk about the course, but like it's so cool to see that he's there talking and walking them through everything. Like he goes through pregnancy, how they can show up in pregnancy and during the birth and postpartum, and lets them know the significance of different things that you will need as the mom, that you will need support with during this whole maternal cycle. So it's really good. It's good stuff in there. And I think that's one thing that I would encourage you to do is just talk to your spouse. Have him prepared with you. Like you're mentally preparing and you're looking up, I mean, you're watching this, so you're obviously looking for support for your home birth, and your husband can be there to support you. So talk to him, share different things. He might not read the book, but maybe highlight a few things that if you're reading a book and say, here, this is what I read, or if you are doing the healthy home birth course, it's easy. You can just give him your laptop at the men's module, and he can just watch through those lessons and learn what learn what he needs to know. So that's a big takeaway for me.
Well, I think bottom line, and I'm speaking to you dads, to the husbands, if even if you're not really on board with a home birth, or you're nervous because you've never had anyone around you that had it,
Mm-hmm.
trust the mom and the mom instincts, and like just go all in.
And
Like
encourage her,
be
even if you're
there.
unsure. Just say,
Yes, be the
"I
biggest
trust you. I
fan.
trust your body."
Be the one that cheers her on, even if you're even if you fake it
Yeah.
until y'all make it. I mean,
Say
but
your
it's
body was
so
made for this. You're doing it, babe. You're doing it. You got this, babe.
it's so like y'all be a team. You are for each other, okay? And I don't know what your situation is, but be for each other at least through this pregnancy and the birth, okay? Um, like cheer her on, okay? And if you're not sure, like learn a thing or two about home birth or in general about pregnancy. If something you've never thought about, if you're not interested, like be interested. Like do it's your flesh and blood as well. That baby that's being born there.
Yeah,
So
it doesn't. You don't have to keep the stereotypical comments from people
yeah, if
that
your
talk
bros
negative.
are like, oh, whatever, like no,
It's an
you're
amazing experience. I mean,
yeah.
like our birth experiences have been like our most like, oh my gosh, moments together ever. So it
And
can
we
be
had quite a
amazing.
few traveling and living in different countries and stuff. So
All six of them have been still, yeah. So
yeah, so I think that's a big thing. Like, don't let your homies talk you into like being negative or whatever. Like, no, that's your child, your flesh and blood being born. So be with your wife, be with the mom, and cheer her on, and learn a thing or two about pregnancy, if even if you're not interested. So
what about the naysayers? What would you say to the couples who are, because that's probably hard for the dads to stand. Maybe the mom sometimes has a little more like, I don't care. I'm doing home birth. I don't care what anybody says. But maybe that's harder for the dads. What would you say?
yeah, I mean,
How do you go about that?
yes.
Your family or friends?
Well, at some point, you just have to drown out those voices. Like, even say, if they say, oh, what if something goes wrong and this and that? Like, I mean, of course, always something can go wrong, and you want to have a backup plan. Like, if something does go wrong, have
We talk about that in the course too.
we'll
An
talk about it in the
emergency
course. But
plan,
yeah,
yeah.
have an emergency plan. But I mean, we had to do that, especially with the first one, because nobody had a home birth. And so we just didn't really engage in conversations, or when somebody talked about,
Hmm.
how was your prenatal appointment?
Yeah,
Which doctor are you using? What? And it's just kind of like
you
we kind of took the easy way out.
you can protect
But
yourself, and that is okay. Like you can just not, if somebody's like, what hospital are you guys going to birth, you don't have to really answer. You can get around questions if you feel like that's necessary, because if you know that someone's going to be a naysayer before the conversation even starts, and you know that they're going to try to put fear in your mind, I would say that would be the time where you just kind of navigate around those conversations and you don't get into it too much. That would be my biggest advice, especially for the mom, because you don't want to have really negative stories or people freaking out and scaring you, or especially if you have family who is really close to you and maybe they'll say anything to you. And so they're going to like tell you the worst case scenario and scare you, then you don't want to invite that in. So just don't talk about it very much. They don't have to know. They can know after, like even a day after, and say, "Oh, we actually had the baby at home." You know, they don't have to. Of course, you need the support and everything, and you want them to be. But if you can sense that they're going to scare you, or they're like pushing you back and making you have fear, because the mom needs to not have fear. You don't need to have fear going into your birth. So
yeah, I
you might
think
have to avoid some conversations.
that, and as also knowing why you're choosing a home birth.
Yeah,
Like really
that's good.
have your conviction, like this is why. And then if you need to write it down and have it ready, then and if somebody doesn't want to agree with you, and they're not going to agree with you, no matter how legit and good your reasons are why you're having a home birth, and that's okay too.
Yeah.
And if you know somebody that had a home birth, and hopefully they didn't have a terrible experience, but I mean, talk to them. And a little, and
Yeah.
kind of a
So
twist to that thing is also like so a little story that kind of turned out positive in a way. So Haley actually had, kind of told somebody we barely knew, um, I don't even know if you even
Well,
lied or
we
something
were
about that to not get the criticism
the
or to.
exact story was we were in like a little parenting small group type thing for new parents pregnant with their first baby in our town. And we met, there was a few ladies talking, and the lady beside me asked me, they were all asking about some, I forgot which prenatal appointment it was, and maybe the glucose test, or I don't remember what it was exactly, but she asked me and I said yes. Just because I was like, so
It was
I
very
wanted to
new,
protect
very,
my space, but
yes.
I also like, I didn't know what to say if I did tell her that I was going to have a home birth. Like it was so new to me. And so I just told her yes. And that was not true. I did not go and I did not have that test. And I felt so bad that I lied to this lady. So then I had to find her. I didn't know who she was at the time. And I had to find her. I knew that she worked at a certain place. And so I went there and asked the lady there. Um, I didn't even know her name. I had to ask what her name was. I was like, what is the girl's name that works here that has long brown hair? But, and so I found her and I got her number and I sent her, I think, a message, or either I called her. I can't remember. And I told her that I was sorry that I had lied to her about that and I was actually having a home. So I went ahead and told her. I was like, I'm sorry, I got so nervous when you asked me. So I actually, my conscience made me made me find her, and she ended up being my best friend for a very long time. Like, she, throughout the whole, all our first two babies were born close together, and she was one of my best friends. And so
Yeah,
that,
and
like, good stuff comes out of that too. Like,
yes, that was my
and by the way,
bottom
she was
line.
never a naysayer. She was like, "You do it, girl." Like, of course.
Yeah, not everybody's gonna come against you, so you will also find people that cheer you on, are gonna be
Yeah.
excited, and it's like, oh yeah,
Or
somebody,
like, "You're so
my
brave. That's awesome."
my I don't know, my aunt or my sister had a home birth, and it was really
Yeah.
great. And then actually somebody, your aunt,
Yeah, my aunt
had
had
how many?
6 home births.
Yeah,
Yeah.
funny. Yeah, 6 home births as well.
Mhm.
And so yeah, and you find those
I
people
didn't
like.
live nearby her. Like, so I couldn't use her midwife or anything like that.
But you
Looking back,
talked to her
yeah.
fairly frequently, and we even considered going over there, even going to her house to have the baby. But she was somebody that cheered us on, cheered Haley
Yeah.
on. It's like, yes, home birth is the way to go.
And my mom was always supportive. So you will have people that are supportive, and then you will have people that will try to scare the daylights out of you and try to get you to change your mind, or or make you feel bad for that decision because you're not doing what's best for your baby. But once you learn the inside scoop of hospital birth versus home birth, you're like, there's no way that a hospital birth is what is best for my baby. So you'll get confident. You'll have that
Yes.
confidence. So
And again, the business of being born. If you haven't watched it already, highly, highly recommend that. I think it's on Netflix. I don't know. It's been a long time
it's
since we
intense.
watched
It's
it,
very intense. So warn
but
your
it's
husband
very educational.
if
Like
he's
I
not
learned,
watching now.
like I was, I was like home birth. Okay, yeah, it's cheaper. Let's go for it. But that was when I watched the business of being born. That was my why. It's like, oh yeah, we're having
Then we got
no way
passionate
around it.
about it.
Then yes,
And that opened up like a whole world of discoveries.
yeah.
And so now we've had 10 years of experience of discovering a lot in the medical industry and just the way that we need to live, and
And also
oh,
like
so
not
many things.
nutrition, like how the ingredients, all the standard American diet, or even in Germany the laws are a little stricter, but still, like what you eat, what should you avoid. And we're the crazy people that look at the ingredients list at the grocery store and sometimes standing there looking like, okay,
And we know before we
and
look at it that we can't buy it if we
yeah,
want to feel good.
yes, but
If it has
it's
a label, it pretty much is not good
it's
anymore.
so powerful if
But it
you get.
makes, yeah.
Yeah, and so we did a lot of research, a lot of nutrition and supplementation and all this stuff. And so Haley's
The
going to
home
share a lot
birth,
in the
yeah,
course.
the
But
home birth discovery opened up our world to a lot of other things with the children and the, how do you say this? The pediatric care for newborns and children, to not say too much. Like, that opened up our minds to where we could educate ourselves. I spent hours educating myself on what we need to do and not do for our babies. And so that was just the door that opened up everything.
And I think one takeaway, which is, probably if you plan on having home birth, you probably care about nursing. And the biggest thing that I've seen was that with our first one, Haley really tried hard, and we ate fairly healthy. Like it's not like, and yet you were able to nurse like 4 to 6
I
months or
breastfed her.
something.
Yeah,
And
my supply started dipping, and I didn't realize
yes,
that my hormones were related. And so that was another thing that I dove into, was learning
and with baby number
about our
3,
health.
we
And yeah,
were. I mean, you were like at some points like, okay, I think I want to stop
well,
now.
I balanced out my hormones with my second baby, and my milk supply was dropping at that point again at the same time as with the first baby, and I balanced out my hormones. I got my health under control, and then I was able to breastfeed him until he weaned, and then the next baby and the next baby and the next and the next.
And that, that is not necessarily something
Huge.
that is pregnancy related. There was any like nutrition and hormone,
Yeah,
like all balancing
I
hormones
would have never had.
was.
I remember not knowing how I would ever take care of 2 babies, because I was exhausted. I looked healthy and I was doing healthy things, but I wasn't well, and my hormones were all out of whack. I had 2 miscarriages and all these things that I didn't understand. So home birth really opened up our pathway to discovering more. I know if I had never opened up home birth, I would have never found out how to balance my body, and I wouldn't be able to be sitting here as a mom of 6 feeling great. Like,
When you
it's just amazing to see the process. And so we have so much that we want to tell you and share
and
with you guys.
you mentioned that, and we don't want to talk about that much because obviously an uncomfortable topic. But miscarriages and also infertility, a lot of times, and not every time, a lot of times it is hormonal issues.
Yeah.
And it's not a miracle to balance your hormones. It is absolutely possible. But I do think a lot of people could have babies that can't have babies because their hormones aren't balanced. And again, I'm not. It's a difficult topic.
That's a topic that's hard to talk about. But we have a little bit of experience with that. And I don't talk about miscarriage in our course, but we do talk about setting the healthy foundation for your body to not only have a healthy pregnancy, birth, and postpartum, but also to feel good like I do now as a mom of 6. Like, it's so important, and to not have to experience those miscarriages anymore.
Yeah, that
If
didn't
it's
happen
possible,
anymore.
like there are different situations with miscarriage, and I understand that, a lot of different situations, but there is a good percentage of miscarriages that happen just because the body is imbalanced with the hormones and everything. So that's a bit of the foundation in the course.
Yes, and our story, the why we chose home birth. So I hope you enjoyed this, and
Yes, we'll be
we're
back with
gonna
more.
yes, and we will be talking about having babies in the United States, in Germany, and in Mexico.
Yes.
That's our
We're going to cover
experiences.
those 3 countries so that you can see the difference in those 3 countries.
The midwiferys,
Yeah,
the care, and
it's really
stuff.
interesting. And our travels in between, so you can understand what we've done and why we've done it.
Yeah.
So exciting videos coming. Stay tuned.
Yes. All right. We'll see you soon.